Okay, so I just wanted to say the next few clips will be video and pictures of my breasts, of how it progressed over time, the redness, the swelling, and the firmness of the infected area. I did cover my nipple, so I went through each clip and picture, covered the nipple, which was so tedious and so annoying, but I managed to do it. And if it's too much for you guys, too graphic, just click off the video. You don't have to watch it. You got the main information from the beginning of the video. But I will also be doing a separate video in regards to my left breast, showing like the progress of how that went, how severe it got while I was pregnant. But yeah, I hope this video helps you guys understand mastitis better. Hope you learned something new. Like, the doctors didn't even know, but they should be, you know, aware of it now, and hopefully they can get it done from the get-go. Like, know what it is, know what antibiotics to give, when to give them, and just hopefully it will, you know, help. But yeah, enjoy the rest of the video. Okay, so I'm not very good at doing voiceovers and editing, but here we go. That's where it started, the redness on the breast. That's me poking my titty, showing where it started to get firm. And then I went to the ER, and they said I had a breast contusion. And that's when they also prescribed me steroids and ibuprofen. That's where it started to get more swollen and inflamed. Then I went to the urgent care, and that's when they gave me the shot in my butt, and it's still inflamed, flossing my teeth, poking my titties. But yeah, now it got even more firm from the last time. You can see it's more protruded on the inside of the breast, and it's a little red too. And on the side it's all soft, but right on the inside it's firm. I was finally able to get a breast ultrasound that was requested by Dr. Portugal, and you can see how one is bigger than the other. Like, you see where the inflammation is protruding out more. Oh yeah, looks like a dinosaur egg. When you push it, like, it's just crazy how firm it got. And that was painful. Her putting the probe on my boob and trying to see what's inside was very painful. And felt like crap, laid down, and it was more red, even redder than before, and it just kept getting worse and worse. There is no end to this pain. Oh, nip slip. Oh well. Yeah, I can see how red it is and swollen, and man. And my skin started to change, like it got cracky. And then I went to the ER, sitting, waiting in pain, sharp pains. And they finally got me to the back to check my breasts. And that's the room that they checked me in. Dinosaur egg. It's so shiny. Oh, it's red. Time to get dressed, which was painful to get dressed. Like, it hurts with like every slight touch. And then they're wheeling me to the ultrasound room, and then they brought me back into the room to go over the ultrasound results or whatever. So the ER doctor said that the actual doctor wants to see me again, so that's why I'm back here. They did the breast ultrasound, so I guess they're gonna talk about the results, and he wants to see my boob. what's going on with it. Mastitis. So I did the breast ultrasound here in the ER, and they brought the doctor in to take a look at my breasts, and he said that since I had mastitis on the left breast, severe mastitis that turned to abscess, I'm more high risk of happening again, which is what it looks like on my right breast. And he asked if there was any pus coming out or anything, any milk coming out, and I was like, no, I didn't try. And he squeezed my nipple in. So I guess it's really bad. They're gonna work on getting me a bed, and I'll probably have to stay here for like a day or two because it said it's really bad. I'm scared. Okay, got myself together. I guess it's really bad. I'm gonna be staying overnight for like a day or two. They're working on getting me a bed, but we'll see how it goes. Look at that 5-star meal. Ham sandwich, Uncrustable with graham crackers, and a Shasta. I had to walk around the hospital like that with my back open. That's how it felt to be on the medication that they were giving me. So they admitted me into the hospital, and I'm scheduled for surgery tomorrow morning to get the abscess on my right breast drained out. And it's the exact same thing that happened to me on my left breast back in 2020 with my second born. Even though I'm not breastfeeding or pregnant, I'm still high risk to get mastitis. That's exactly what happened. And the mastitis turned into an abscess that needs to get drained out. So that's what's gonna happen tomorrow, or actually this morning, because it's 2:22 in the morning right now, and the surgeon's gonna come like around 8, I don't know, to do the procedure and drain it out, and then they might keep me in a little longer just to see if the antibiotics are working. It's 2:30 in the morning, and I can't go back to sleep because the pain medicine hasn't kicked in, and I'm thirsty, but I can't have any water, so this sucks. The pain is so unbearable right now. Like, it's a 20 out of 10. Burning sensation all over the boob, on my nipple, everything is just horrible and so painful. They finally gave me some good medicine. It's called Dilaudid, and they put it through the IV, and I'm feeling better. Feeling good. It's like a weird sensation when they put it through the IV. Felt like my whole body was kind of like tingling and going to like a really deep relaxation, which felt nice. But yeah, hopefully the pain goes away. That operating room was completely empty. Not gonna lie, it was kind of scary. The transporter was like, hello? Anybody here? I'm like, don't leave me here, please. It's haunted. And then the doctor wrote on me to make sure she operates on the right side. That's after surgery. And so when I woke up, they bandaged me up. Really tight and stiff. And it was the 4th of July, so I was watching the fireworks outside my window for a little bit. It was cool. This is my bedroom for the meantime. That's when I was feeling much better. And it looks like they put a cast on my boob, and then there's like blood seeping through the side. And of course another 5-star meal, hospital food with the biscuits and egg. It was actually pretty good, not gonna lie. The biscuit was pretty good. And then it was time for me to get ready to go home. They did some blood work and everything went well. Everything looked good. So they're like, okay, well, you can get dressed and we'll send you home. But the thing is, they didn't even send me home with any equipment to change the bandages or anything. So I'd have to stick with that. And then my sweet husband got me some balloons and flowers. That's it. Hope you guys enjoyed the video.